My name is Polly Pittman, and I direct the Fitzhugh Mullen Institute for Health Workforce Equity. Welcome to the fourth session of the Mullen Institute mini-series on emergency health workforce policies to address COVID-19. This session asks whether national enforceable occupational standards are needed during the pandemic, and if so, why don't we have one for airborne diseases? By way of background, it's important to note that there are international human rights laws that affirm that governments have an obligation to minimize the risk of occupational accidents and diseases, including by ensuring that workers have health training and information and adequate protective clothing and equipment. Accordingly, the World Health Organization has also issued guidance with a list of 13 health worker rights relevant to the COVID-19 pandemic. 8 of these, which are listed in this slide, and we will make these slides available in the resource section of our website, relate to the right for training on infectious control and the right to appropriate protective gear. To discuss why occupational safety standards are so important during this COVID crisis, we have 3 invited guests who from different areas of expertise will share their thoughts on this issue. First, Dr. Peter LaPuma is a professor at the GW Milken Institute School of Public Health. He's an expert on occupational health and has a special interest in health workers during the COVID-19 crisis. Prior to joining GW, Dr. LaPuma was a faculty member at the Air Force Institute of Technology and the Uniformed Services University. Second, Dr. Melissa Perry is the chair of the Department of Environment and Occupational Health at GW Milken Institute School of Public Health. Dr. Perry also chairs the Board of Scientific Counselors for the National Center for Environmental Health, Agency for Toxic Substances and Disease Registry at CDC. She also co-chairs the National Academy's Standing Committee on Use of Emerging Science for Environmental Health Decisions. Last but not least, Kelly Troutner is the Director of Nurses and Health Professionals at AFT, the American Federation of Teachers. She also directs the Occupational Health Department at AFT. She's an attorney by training. Peter, I'd like to start with you and ask you to give us some background on the science of the occupational safety situation during the COVID-19 crisis.
Sure, thank you, and thank you very much for having me. It's my honor. I'd like to start out by saying, having retired from the Air Force, I get thanked a lot for my my service to the country, and I would like to return that to the healthcare workers out there and say thank you for your service to the country. It's a challenging time, no doubt, out there. One of the things I wanted to do is just sort of drop back a little bit and talk about the fundamentals of protection of PPE. I hear a lot of politicians out there with varying degrees of understanding, and I just wanted to make sure we're all on the same page. First of all, let's talk about that all-important N95 mask. I wanted to start out, without getting too technical here, that there's different types of filtration that occur with the mask. And larger particles tend to be filtered out with certain mechanisms, and small particles, such as the virus itself, which is very, very tiny, get filtered out by other mechanisms. So the large particles might be things like droplets that spew out of our mouths when we're talking or singing or coughing, whereas the virus itself, when some of those droplets dry out, you're left with just the virus, and so you really have to cover a full range of different types of particle sizes. If we can go to the next slide. And the N95 mask has a specific test that all manufacturers must meet and perform at. It really doesn't matter what the mask is made out of. The material is almost irrelevant. It has to do with the performance of that mask. So one of the phenomenons that you see with filtration is that there's one particular particle size that is the hardest to filter. It's 0.3. That's because those filtration mechanisms work well for large particles, others work well for small particles, but the hardest thing to filter out is that 0.3. And if we can go to the, the National Institute of Occupational Safety and Health have a test where they actually produce that 0.3 micron sized particle, and they test and make sure that 95% at least get filtered out. So it's a very stringent standard. And so the mask you see here on the left-hand side is the N95 mask that had to meet that very stringent standard. The surgical mask has a much easier standard to comply with. The surgical mask is really designed to protect not the wearer as much as the other people. So if you're sick, if you have a cough, it does a pretty good job at stopping the very large droplets, which are pretty easy to stop. But for any healthcare worker that is patient facing, they really need to be at least in an N95 mask. That should be the minimum standard for a healthcare worker. And that's because it does a good job with a wide range of particles. You can see that the surgical mask is not even designed to have a good face seal. So when you draw air in, air can rush around the sides, and then those small particles can readily get into the system. So at a minimum, that N95 or better. We can go to the next slide. So here on the left-hand side, I call it my kind of my good, better, best. I've spent a lifetime putting people into masks for paint applications and pesticides and things like that. And I can tell you that I would at least reach for the middle respirator. And that's because it's made out of silicone and it's got a better face seal. And that face seal is very important. If you have a beard or if there's a leak of some sort, then particles can get in. So not to say that the N95 is a good mask, and it has to be fit tested and properly worn, and so people need to be trained on how to use it. And then the middle mask, called the elastomeric respirator, or we call it the half-face respirator, is better yet. And then the best would be the powered air purifying respirator, which delivers filtered air right into the face cavity itself, pushing out particles constantly so that there's even less worry about the face seal. So at a minimum, healthcare workers really need to have standards to protect them for the varying degrees of risk. Now, if somebody is not patient facing and they're in a low risk kind of an environment, maybe the surgical mask would be okay, given that we, especially during the pandemic crisis itself, we have to shore up the supply because there are shortages out there. And one of the things that could be done as well, and I have several nursing friends and family members, and what they tell me is they see a lot of pilfering. They see a lot of people taking equipment that is sitting outside of rooms that the nurses need to go into the rooms. And because of the panic buying and the gouging and things like that, people are taking them. So we need to put a stop to price gouging and hoarding of this equipment and make sure that we have supplies for our healthcare workers. That's it for me.
Thank you, Peter. Melissa, I'd like to turn to you. We all obviously have been reading in the news about the shortage of PPE. That's a reality in terms of the supply. So why do national standards that are enforceable matter if there's actually sort of a physical limitation in terms of the supply? How would that change things?
Thank you so much, Paula. Thank you for the question, and thank you for having me for this important webinar. It's such a critically important topic. We're very, very concerned about the health of healthcare workers. A standard right now would have a tremendous impact on ensuring that healthcare workers are getting the proper protection that they need. Yes, we understand that there are critical supply shortages that we've been facing, and we anticipated as soon as we understood that the virus was coming to the United States, we all in epidemic response understood that we didn't have the national supplies needed to respond as critically and quickly as possible to ensure healthcare workers were getting protected. At the same time, all the more reason that a national standard has to be enforced and has to be established. I've got a great example from the early 90s when HIV/AIDS was first becoming an epidemic in this country. And we understood that healthcare workers were being exposed via contamination with bloodborne pathogens. And so a bloodborne pathogen standard was established. Now, you can imagine that at that time there was a lot of resistance, there was a lot of concern, there were concern on the part of employers as to how they're going to enforce it. Dentists complained and said that they wouldn't be able to practice dentistry if in fact they were being held to all of this protective equipment. But in reality, what ended up happening is that we saw a significant decrease in needle sticks, and also in hepatitis B cases, work-related hepatitis B cases among healthcare workers. So it's a really important example of the way in which protections were enhanced and optimized for bloodborne pathogens. It's exactly what we need currently as it relates to airborne pathogens. And the Occupational Safety and Health Administration had made major progress toward establishing that. And it really was at the beginning of the current administration where there was a rapid shift or pivot to anti-regulation, that all traction, all movement on the airborne standard for workers across the board, healthcare workers, all workers that could be potentially exposed to airborne pathogens, that came to a screeching halt. So there's an opportunity now for, in fact, the president could issue an executive order to put forward an emergency standard. And I believe the country is working to overcome the PPE shortages. So I believe that there's a strong push for greater production of the necessary PPE. And so setting that standard could even accelerate and further affirm how necessary it is that all employers are providing the adequate protections for healthcare workers.
Thank you, Melissa. I want to come back to this issue of enforceability and how that would be applied in the current situation, but I'd like to turn first to Kelly. Kelly, you represent about 150,000 frontline health workers, nurses, physicians, and allied health professions. We know that there are over 100 complaints that have already been filed with OSHA, and that there are over 1,000 complaints that have been sent electronically to employers. How would the issue of standards affect that process of reporting situations where workers are not adequately protected?
That's a great question. So I think that in terms of how complaints would affect the standard, I'm not sure that it would. In some places where there are state OSHA laws and state OSHA agencies, there may be a more effective venue for employees to seek recourse when employers, in some cases right now, through no fault of their own, are placing employees, healthcare workers in this case, in a position where they aren't safe at work doing what they do. And I would say that recent decisions by federal agencies to promulgate weekend guidance has a lot of our healthcare clinicians asking, why are standards important? Because they're so hard to enforce. We have, OSHA who is saying, they've suspended the requirement for fit testing for the N95 masks, which Peter mentioned earlier, which is, critical for ensuring they have a proper seal and that people are protected from the particles that are in the air with, this virus. And there's a lot of debate about whether the virus is transmitted through droplets or whether it's aerosolized, which makes the importance of respiratory protection so very important. What I've seen, I've been representing healthcare workers for a very long time, and respiratory protection, unless you work in an operating room or someplace where it's customary to need respiratory protection, it just isn't something that people think about. They want to assume that they are safe when they go to work. And I will say that we were very disappointed when the CDC changed their infection control guidance and weakened the requirements for respiratory protection. And one thing that was so unsettling is that the decision to change the guidance, and if you look at the guidance, was made based on supply chain and not on science. And at the same time, the CDC was also claiming, really without evidence, that the virus that causes COVID-19 was primarily spread via droplet. So, we're really disappointed about, some of the conflicting advice, the conflicting guidance. Then you have OSHA in the mix. OSHA is saying they don't have the capacity to enforce. They're not going to send people into the hospitals. And, you know, at the end of the day, employers, I think, have a legal and a moral obligation to keep people safe at work. And we expect them to do this by taking steps to minimize risks of hazards in the workplace and in healthcare right now, COVID-19. And, you know, we have in healthcare accrediting bodies like the Joint Commission that monitor practices and really in some states have proximate authority to create standards in healthcare. Our people, all of us, really rely on the government to set standards, to define what steps need to be taken to keep people safe. And you know, we really expect them to use our tax dollars to fund science and research so we know things like how a virus that has torn through nations around the world for months is likely transmitted, and what precautions and protective gear need to be used by people caring for patients. We expect the government to, you know, ensure that they're, you know, through our public health infrastructure, through our national strategic stockpile reserves, through all of the things that we need to do to be prepared, that we're ready to deal with this, and not just for the safety of our healthcare workers, but, and our healthcare workers would say, especially for the people who are under their care. So standards are really important. And why are they important to our healthcare workers? Why is it important that we get them right, get those standards right? We're seeing it now. We have healthcare workers who've actually become the vectors of the virus because of their exposure. We have healthcare workers who, instead of taking care of patients, are occupying beds, or who are on respirators, and in some cases have died because the standards aren't there to keep them safe. And this is the job of our government, and that's why it's so important.
So Kelly, just one follow-up question. Yes, go ahead, Peter.
Oh, I was just going to tack on something real quick that Kelly mentioned that I think might be important to draw out. OSHA not being able to enforce has always been a problem for OSHA for all businesses. They're a very small organization, and they can't, I think there's something on the order of one OSHA inspector for 2,000 businesses. There's no way they could possibly be out there. That doesn't mean you lower the standard. You make a standard to protect people, and you enforce it by other means, not necessarily being out there as an inspector, making sure people are complying. You rely on the obligation that the company has to make sure that they comply with the standard that OSHA writes.
Yes,
sorry.
exactly.
I
Exactly.
had to tack on something there. That was a really good point.
Thanks, Peter. That's a great point. And I was wanting to circle around to that again as well. But Melissa, you mentioned the possibility of the president issuing an executive order. You know, I gather there had been some hope that this would be included in the emergency funding bills coming out of Congress. I wonder if you could speak to why it wasn't included, and what the arguments are for not including it, and whether there's any hope for a breakthrough from a political perspective in terms of coming to some consensus on the importance of standards.
Sure. No, those are good questions. And the issue of the why and what were the sources of resistance and what's the look for the future. The why has to do with, in this time of emergency and crisis, and as was alluded to by Kelly and also Peter in terms of supply, it's an idea of, well, how could we possibly enforce this? Which is all the more reason why it has to be. We have the Centers for Disease Control, and we have the World Health Organization, both of which are advisory bodies that are giving guidelines and recommendations, but they can't enforce anything. And so that regulatory muscle, if you will, is critically important. The resistance and the arguments beyond the supply, which is really unjustifiable and not scientifically based whatsoever, and creating greater risk for healthcare workers, and as Kelly pointed out, the patients as well. The resistance is also very predictable, which is employers pushing back to say, how can we possibly enforce this? How can we possibly afford it? How can we ensure that all workers are getting the PPE? Now's not the time to come down hard on employers. But what you can look back on other occupational standards is that that's always the argument. That's always the argument. Workplaces will resist and say, we can't do it. It's too much pressure. It's too expensive. It may drive higher costs that we can't possibly incur and afford. And what you'll often see is that after the standard was enforced, workplaces and businesses don't go out of business. They actually change and adapt in order to enforce the standard. So the bloodborne pathogen standard is a wonderful example of all of the benefits that came to healthcare workplaces after it was finally adopted and enforced. So that was another source of resistance. I'm encouraged, we're doing this webinar, many sectors around the country are clamoring for attention to this issue. People can simply call their legislative offices to draw attention to the need to enact a presidential order. Now is the time to clamor, and as Peter said, occupational safety and health has been woefully underfunded and defunded over the past 30 years. There's no better time than right now to highlight that, to demonstrate the incredible vulnerabilities that we're experiencing in workplaces. We're focusing on healthcare workers, and at the same time, there are other public-facing jobs that are not getting the protection that they need to in these other essential businesses that are still open during the shutdown. A standard would ensure that employers would be required to do that. So I feel very optimistic with continuing attention and clamoring that this could be achieved. It didn't make it into the bills for the sources of resistance and arguments that I mentioned.
Kelly, I know that at least one physician has been fired for having spoken out around the situation of feeling that the health workers were endangered by lack of protective gear. What are the mechanisms that you all see from an organizing perspective for elevating this issue at an individual or a collective level to get more attention to it, and what can be done to protect the rights of clinicians that do dare speak out about this at the organizational level?
So this is an outrageous and untenable situation. You know, unionized healthcare workers, whether it's docs, nurses, really in all disciplines, they're commonly outspoken advocates for patients and for each other. But one thing that I've thought about recently, when you have unrepresented nurses and doctors who are going to such great measures and assuming the risk of filming diaries for TV journalists after their shifts to describe what sounds like a scene that we would see in a sci-fi movie, something is amiss, and we all really need to listen to what they're saying. Sadly, I know from talking with our members, the federal government agencies really have little credibility right now. And those are the folks that, our people believe they should be able to rely on to help them. And, healthcare as an industry has evolved into corporate markets, publicly traded companies, et cetera. But the people who take care of patients haven't changed. They want to help us heal. They want to see miracles happen. They want to take care of all of us. And I think, trade associations and some of the disease groups are really important, but, often they're funded or supported by industry players. I think we owe it to our healthcare workers to find a way for them to speak out. Town halls with members of Congress are really, I think those are an important way. I think a lot of members of Congress are putting themselves out there, trying to connect with the healthcare community in their districts. Investigative reporting that's happening can be effective, but that only goes so far. You have to have a hot story to tell that nobody else is is telling. My personal opinion, not surprisingly, is that concerted activity, having a collective voice through a union is the most powerful vehicle clinicians have right now, both in speaking, truth to power to the government and to the employers, and looking at some of the actions that I've seen on TV, pictures of nurses and doctors you know, adhering to appropriate social distance advice, but having like a red ribbon tied around, you know, holding a red ribbon between them going around a hospital, all of those sorts of things. I know in the past, another nurses union did a series of die-ins during the Ebola crisis. These are the types of things that most workers don't have the right to do, even though the law, presumably Section 7 of the National Labor Relations Act, does not only apply to people who have a union. Sadly, enforcement right now of the NLRA is, you know, it's not at its best right now. It's not the easiest process, but I think people have the right in this country to speak out about, you know, unsafe and untenable working conditions. And, you know, I know our union is definitely at the ready to defend not only our members, but other workers who are doing that. And I think that, you know, this is a moment, you know, I posted something on social media the other day about the irony of healthcare workers being given the advice to use a bandana to protect themselves. I'm from West Virginia, so if you know the story about the rednecks, you know that there is a tragic irony here. And healthcare workers are seeing that unions have not outlived their purpose, that we have a role, and right now it's a very critical role in protecting people and saving lives.
Thank you, Kelly. I will give Melissa and Peter, just if you have a final word of reflection on this issue before we close the webinar.
So yes, what I'd like to say is that I'm really appreciative that you're doing this webinar, that if you're a healthcare worker that's watching this, that you know that you're not alone. I wanted to echo Kelly's recommendation about attempting to reach out to your union. I think continuing to document your experiences is very, very important as well, because it provides more evidence and more data and more stories so that we can better highlight it. And it really is can be a united push, a national push for invoking a presidential order for emergency temporary standard. I think that's the language, that's the talking point. And let this be a pivotal time for occupational health and the united necessity of protecting healthcare workers and all workers.
Thanks, Melissa. Peter?
The "you're not alone" message, I think, is a really important one right now. You certainly aren't. In fact, it is maddening that we do not have the appropriate amount of PPE. I hope at the other end of this, we come out a much smarter nation. I hope we take public health and preparedness a lot more seriously. Right now, we're obviously having to resort to some draconian practices in order to just sort of get by. But do know that your health and safety, the health and safety of healthcare workers, it is paramount. We absolutely have to protect the healthcare workers at all costs.
Well, thank you, Kelly and Melissa and Peter, for this amazing webinar. We do have a function on our home website where folks can send in questions and comments. If people have stories or if people have ideas about things that can be done, of course, they'd be very welcomed, and we will try to promote them through social media and through this webinar series. So thank you very much.
Thank you, Polly.
Thank you, Polly.
Yeah, thanks for having me.